just do your job.
I'm trying to. It's really...
Honestly, the jobs are not well defined, so.
Okay. Welcome everyone back to the Face Duo. I'm Dr. Tripathi. I'm a facial plastic surgeon at Bay Hills Plastic Surgery in the San Francisco Bay Area.
And I'm Dr. Brandon Dunn, and I'm a facial plastic surgeon as well here in Orange County, California.
Today we're going to talk about something very common that you guys ask almost in all of our videos, and definitely in all of my videos, is how to treat the neck. So if you're 20 or you're 50 and you have fullness and you think you have a double chin, or if you're 60 and you have laxity, how do you treat the neck? Is there a one size fits all? What do we do with the neck that's non-surgical and surgical? How do we get those really nice snatched results? Let's get into it.
So number one, skin,
okay,
muscle, fat. You got to think about all of those things when you're when I'm evaluating a neck.
Yes.
And so skin laxity, muscle laxity, excess fat. Those are kind of the big things. As you get older, things start to relax a little bit.
Well, I get a lot of questions about Kybella. So Kybella is deoxycholic acid. It's a bile acid that dissolves fat, right? So if you inject it in particular, yeah, it sounds great, right? It sounds great. And the idea was that it creates a lot of inflammation, so the fat gets digested and then the skin shrink wraps around it. In very small amounts, for people that have a tiny bit of fat right here, I think it can actually work quite well. The selling point is that it's really a non-surgical procedure, right? It's just injections.
Right.
You do need multiple sessions of it, and the results are variable, but it's relatively well tolerated. You have a little bit of swelling. You can have some nerve damage from it, but ultimately it's an in-office procedure that's pretty painless. You have some pain, but it's not so bad.
I would say the one thing about that is that you end up spending almost just as much as it would cost you to do a minimally invasive surgical procedure.
Exactly.
So the double chin is fat above the layer of the muscle. And so that's something that's important to differentiate. And so Kybella helps to treat that fat. And then the other option is submental liposuction. So the way this works is 3 small incisions that are made underneath the chin as well as at the earlobe attachment. And that allows me to contour the fat just underneath the skin. And so that's a really effective way at helping to give more definition to the neck and helping to remove that fat that's sitting on top of the muscle.
Okay.
And so minimal downtime, pretty early improvement that you see right away, but it is a surgical procedure. There is a little bit more pain, there is a little bit more swelling, but again, when you think about Kybella, it ultimately, I think, evens itself out.
Yeah, Kybella, you have 3 downtimes if you do it 3 times.
Right.
So really, in my experience, same thing with liposuction, you may have 5 to 7 days of sort of bruising and swelling in the neck. I've done it on staff members before, and they've gone to work the next day. It's really not that bad. Yep. I do think that you have to get over the fact that you're having a surgical procedure done, but in general, it's pretty well tolerated. We do them in the office. It's under local anesthesia. You don't have to even go to sleep for it, and it takes about all of maybe 30 minutes to do.
Definitely.
So I have patients that say, well, I have a small bit of fat in the neck, but I also want a chiseled neck and jawline. And so for these patients, no matter what their age, well, up to about say 35, I do explain to them that while liposuction is nice, it's really not going to address that jawline very much. I mean, it will somewhat. I do try and sculpt the jawline with some liposuction, but ultimately that muscle is really the culprit when trying to get a lax lower face to be tightened and sharpened again. So what I perform in patients up to about the age of 35 is what's known as an extended deep plane neck lift. And that's an isolated neck lift where we contour all the layers of the neck. We sometimes remove a little bit of skin, we remove fat in multiple layers, and we release the muscle along the jawline and tighten it along the jawline. That really gives people the longest lasting result and the most natural looking, as well as the most sculpted neck and jawline. And you don't have to be 75 to have a procedure like that done. I think whenever anyone hears the word neck lift, they automatically assume it's for an older person.
Definitely.
And it's really just a product of like what is going to look the best for the treatment that you need.
This is a quicker recovery time than something like a facelift or something of that sort. So it does have some downtime, it does have some bruising and swelling, and it does take some time for everything to ultimately mature and fully heal. But I think the results are, if you're looking for the pinnacle of treatment options for a neck, that is really a result.
What if I'm somebody who's maybe 20s, 30s, maybe a little bit older?
Yep.
I don't want to I'm adamantly opposed to have anything surgical. So I don't want liposuction, I don't want a neck lift, and I'm okay with maybe a 10, 15, 20% improvement. What are some non-surgical options that you've kind of seen or that you like?
So radio frequency or electric currents or something like FaceTite or Vaser or these types of energy-based devices that are introduced underneath the skin that help to kind of liquefy fat as well as tighten the skin and the dermis. It's most effective in conjunction with other procedures
I totally agree, yeah.
like submental liposuction. So I think if you're willing to kind of undergo a little bit more and willing to understand that taking out a little bit of that fat and then tightening everything else so it kind of shrink wraps over everything. I think you're really yeah, exactly.
Yeah, I mean, any patient that I do liposuction on or do a neck lift on, I automatically do radiofrequency treatments either 4 or 8 weeks after, because I do think during the healing process, it can create an additional tightening element.
Yeah.
In isolation, I have seen some nice results from things like radiofrequency microneedling or alt therapy. These, again, are energy-based treatments. I think they work well, but they're not permanent solutions, and I think there's a limit to how many times you can do them. Right. So I agree that they work best in conjunction with surgical procedures.
One of the things I will say about these devices, if you're doing them on their own, does this preclude or does this affect a future facelift or a future procedure? What do you think?
So I tell patients that it's not going to stop you from getting a facelift. I mean, we as surgeons are used to operating in a field or in an area where there's a lot of scar tissue. So these treatments, while they're great, they tighten a bit. They tighten by like contracting tissue together, so you develop scar tissue in that area. So it's not going to stop you, but it can make it more challenging. So if I have patients that are on the fence, I do explain to them that I wouldn't do this and then a facelift 2 years from now. But if you're like not going to ever have surgery and you want a small improvement, I do think that it's a nice treatment option. I think the other thing is if you go to a place that only offers non-surgical solutions, you're only going to get a non-surgical option. So I think having all the information is important, but ultimately we're used to operating around scar tissue, and these things do create scar tissue, as does Sculptra. Right. Anything that is building collagen under the skin is going to create some scar tissue, and that's just going to make it a little more challenging during surgery.
If things are introduced in areas where they shouldn't necessarily be, and so that's, again, a reason why to go to a professional and make sure that you go to someone that knows what they're doing with these treatments, then it can make your surgery a little bit more challenging and kind of introduce additional risks that maybe someone otherwise would not have.
Yeah, agreed. So, okay, how about for the 65-year-old woman, she's not only got neck laxity, but lower face laxity. Can she get, and I've had this too, can I just do a neck lift?
If you're treating just your neck, I think, and you have signs of aging in the face, and I think you would not do someone justice if you didn't treat their lower face as well. Definitely. And so my recommendation for these patients are always a lower face and neck lift. Again, these incisions heal incredibly well. They're hidden in natural creases and contours and things around the face, and so they end up fading away to practically nothing with time. My approach is an extended deep plane facelift where, I help to lift and reposition the jawline as well as the mid face, and then help to tighten and contour the deeper neck structures too.
Yeah. Agreed. And remember, a facelift, most people think is like your entire face, and you can do your whole face, but a facelift really treats the lower face and neck. So for somebody in their 50s and 60s, that muscle is all one muscle, and you can't just isolate the lower neck, otherwise you're going to have an unnatural looking result. So in summary, treating the neck is complicated. It requires understanding all the different levels of where your treatment is, and really knowing what you're getting into and setting the right expectation. So if you're interested in more of a non-surgical treatment, there are some options. A lot of this depends on how old you are and with the degree of the laxity that you have, whether it's muscle, fat, skin, or all three, and finding the practitioner that is going to give you all the options to optimize your treatment. So options like Kybella or fat dissolving, which are in-office liposuction, extended neck lifts, or face and neck lifts. These are all options depending on your age, your degree of laxity, and what you're looking for. If you're interested in this kind of stuff, leave us comments, subscribe, follow, like our videos. We'd love to do more of these, and we'll see you next time for another episode of The Face Duo.
All right, take care, everyone.